Hi guys, it's Dr. Bishop here. Today I'm going to give you a short video on understanding articles comparing therapy. In this video, we are going to lay out the framework for going through the 3 stages of appraising a research article about therapy. Before we start reading an article, we need to clarify a quick question. First of all, what is therapy? Therapy is very broad. The 2 most obvious types of therapy are a medication that we give a patient or a surgery or procedure that we perform that treats a medical condition. But therapy can include other things. It can be other types of therapy like talk therapy for a patient, or it can be interventions that we do to improve how we deliver medical care, like giving patients home blood pressure monitors. So when you are reading medical articles and looking for articles about therapy, I'd like you to remember that therapy has a broad definition. One key thing to think about when you read an article about therapy is how the study is designed. If you remember from our previous lectures, the gold standard study design in a study about therapy or an intervention is the randomized controlled trial. Remember, in a randomized controlled trial, a group of patients with a certain medical condition, or the eligible patients, are randomized to receive either the treatment or the control. The main outcome and any secondary outcomes are measured for both groups, and then these outcomes are compared. There are other ways to design studies that compare treatments and controls, but we are going to focus on the randomized controlled trial because it is the gold standard study design. For the next few videos, as we learn about reading an article about therapy, we are going to work off of a clinical scenario. For the purposes of this lesson, the scenario happened several years ago because the study that I'm using is an example that was published in 1999. It's an oldie, but it's still a goodie. So here's the situation. You have a patient with advanced heart failure, sometimes called New York Heart Association Class 4. This patient was watching the news one evening and saw a story about a study that found that the medication called spironolactone reduced mortality in patients with advanced heart failure. He calls your office the next day and wants to know whether he should start this medication. As a responsible doctor, you track down the article and read it. After a quick review of the study, you develop a PICO question. Among patients with severe heart failure, does spironolactone versus placebo reduce mortality? Now you are ready to read the article in more depth. Like almost every research article, it follows the same format we discussed in the Anatomy of a Research Article video. A copy of the article is in Canvas. Feel free to read it now or refer back to it as we go through this video and the next few videos. Like every research article, we're going to go through the 3 steps of critical appraisal. In the next video, we will focus on the first step. Are the results of the study valid?